Good afternoon. My name is Dr. Stephen Masharia. I am a general and trauma surgeon, and today I want to give a general talk about men's health. The reason for this is this is the June is the International Men's Health Awareness Month, and it is a fitting time to talk about those topics or those issues that affect men and which require to be addressed. And the reason especially is that men don't seem, for some reason, to give as much attention to their health as women do. And yet there are many conditions that affect men's health. The main ones being accidents, cancer, especially prostate cancer, and depression. And the result of this is that men have a lower life expectancy. And so I will go through some of the conditions for more detail and then talk about those things that we're supposed to do to address these concerns. The main ones being prostate cancer and colorectal cancer, but there are others as well. Like in this country, esophageal cancer is a big problem and has a predominant impact on men. This is compounded by the fact that men tend to have less attention to their health. Health-seeking behavior is much less from men who are independent, not under their parents anymore, so that fewer men tend to go to hospital than women. And in fact, in many cases, men tend to consult doctors based on the pressure or request from their wives. And for that matter, you'll find many gynecologists tend to be the primary doctors for most families, which is really not very appropriate, really, or rather, not. It is common because most doctors that women know are gynecologists, and so that is why that happens. Now, the following are the conditions that are likely to affect men, the most common causes of death: heart disease, cancer, non-intentional trauma, stroke, which is related to high blood pressure, and lifestyle diseases like diabetes, then pneumonia, suicide, and kidney diseases. Kidney diseases might be aggravated usually in men by the fact that prostate problems, benign prostatic enlargement, and prostate cancer are conditions that affect men later in life, and they have a direct impact on kidney health. How do we address these conditions? Or even if one does not have a problem, how would you go about dealing with these conditions? The best way to deal with it is to have regular checkups, and we propose regular checkups in a well-manned clinic, which is a clinic for people who do not have a problem but who require certain things, just to certain tests to ascertain that their health is not impacted adversely. So the purpose of a well-manned clinic is to detect and reduce risk factors for ill health, and to detect problems early and to manage them, and generally to encourage healthy living, which is the best way to deal with lifestyle diseases. Now, what tests are normally carried out in a men's health checkup, or how do you conduct a well-manned clinic? So a well-manned clinic is conducted annually, and the things that are normally tested are blood pressure, height and weight. Lab tests generally that are conducted are total blood counts to check the general health, because the blood tells a lot about one's health or otherwise. Check up for cholesterol, check up for prostatic specific antigen, which is a PSA in short, and that is a marker for prostate cancer, which is the leading cancer in men. And this is recommended for men who are from the age of 40 and above. An annual PSA check is important. And other tests can be done on a need basis. Risk factors are to, these tests are to check for the following risk factors, for example, for heart disease, or rather the risk factors that aggravate or cause heart disease are smoking, obesity, and obesity, also called metabolic syndrome, is a big risk factor, or a common risk factor for diabetes and high blood pressure. Then high blood pressure itself, sedentary lifestyle, which is a big problem in these times, probably now lately aggravated by the COVID pandemic. And male gender, being male is actually a risk factor for heart disease, and many men from the age of 45, the risk of a heart attack increases, especially if one is a smoker, is obese, is hypertensive, and has a history of diabetes or high blood pressure in the family. And so this is a very important checkup to ward off that danger. Then cholesterol is another risk factor, and stress. And stress is part of modern day life, and is caused generally by so many problems: financial concerns, economic concerns, social, and so it is something that one may not be aware of, but which, if one is aware, they need to actually take measures to reduce stress, because by so doing, one is able to reduce the risk of heart disease. The screening tests for heart disease are blood pressure, fasting blood sugar, cholesterol tests, body mass index, blood glucose, and glucose tolerance tests. Those are tests that are used to detect people who may be prone to diabetes but who have not shown signs as yet. They are so-called latent diabetics. And the commonest, this commonly affects people who have a high BMI. Besides the checkups, one can get dietary advice in the Wellman Clinic, and the purpose of dietary advice is to help one to maintain normal body mass index, and to avoid situations where one may be to avoid an unhealthy diet. Because some diets, for example, red meat, which is a favorite of many men in nyama choma joints and etc., is a big risk factor for certain cancers, and even certain lifestyle diseases. Can aggravate heart disease, can aggravate diabetes or metabolic syndrome, can aggravate conditions that might affect the kidney, like gout, high levels of uric acid. And so it is a condition that one needs to be able to take care of their diet. A third of the plate is carbs, and it's usually recommended that if somebody has a higher BMI, they can reduce their carbs to improve, to reduce the amount of calorie intake. Then a third should be salads and fresh fruits and vegetables, and these are very important because they are rich in antioxidants, and this help in warding off or fighting the risk of most cancers. And the other third is several types of proteins, and you can get more details of this when you come to a Wellman clinic. And the other advice that one gets in a Wellman clinic is about exercise, and exercise is very important in being able to ward off or to deal with the risk of heart disease, risk of hypertension, and the risk of metabolic syndrome or these lifestyle diseases. And the exercise need not be necessarily in a gym. In fact, walking, for example, is very important. Exercise, a walk or a jog, which is something within the ability of anybody, of most people. You can be able to do a jog or a walk or 3 kilometers 3 times a day is adequate exercise. And the purpose of this usually is, one is aiming to raise their heart rate above normal for about a period of at least 20 minutes or 20 to 30 minutes 3 times a week. That is adequate exercise, and that combined with diet will help one to keep a relatively healthy, to lead a relatively healthy life. And then exercises at home can be conducted, simple exercises which one is able to conduct at home, not necessarily in a gym. And if one has access to a gym, that's even better. Of course, you will have access to trainers who can advise you on the right kind of exercise. These problems can be noted sometimes when one has taken a few drinks, then they are having challenges passing urine. Sometimes these symptoms come more slowly. For example, when one is in a meeting and they feel the urge to go to the gents, it is a kind of urgency. One gets a kind of urgency that makes them unable to hold, and you feel that you have to go. And yet, when they get there, they are not able to pass urine immediately. It may take some time. So there are some of these things that you can get advice about. And prostate enlargement does not necessarily mean one has got to be treated for it. And it means, usually out of 10 people with prostatic enlargement, only about 1 or 2 will have prostate cancer. And so cases of prostate cancer, while being actually quite prevalent, are not likely to be affecting all men. But the only way you can find out is by having the relevant tests, and then that can be addressed. So I'd like to conclude by telling you a few things that will help to improve life expectancy, and also a few things that will lower life expectancy as to in conclusion. So, contrary to popular belief, alcohol is not necessarily something that injurious or damaging to health, as long as it's taken in moderation. So one alcoholic drink is said to add about 30 minutes to a man's life. If you take an alcoholic beverage once, and the fact one way that alcohol might benefit one is it helps to relax and reduce stress, but when taken in excess, then it has very serious consequences to one's health, especially the liver, the brain, the body generally, and so it is something that has to be done in moderation. Then coffee, also in moderation, is beneficial, and we'll show you the chart because it's here. Then cardio, exercise, that is, there's some exercises that are like walking, jogging, running. They are actually very helpful because they help to build muscle, to build strength, and to improve blood flow and cardiovascular health. Then vegetables and fruits, and generally taking plenty of vegetables and fruits, very important because of their contribution to the diet in giving one antioxidants, very important component to ward off many cases of cancer. Then dangerous things in one's life, excess alcohol, of course I said that before. Watching TV for 2 hours, more than 2 hours, is said to reduce 30 minutes per session. It's something that is said to reduce life expectancy by 30 minutes. So that is actually just to focus on sedentary lifestyle, that is something to be avoided. Eating a portion of red meat. Okay, well, red meat should be taken in moderation, and in fact the kind of meat that we recommend is white meat, fish, poultry, or chicken, turkey, and less of red meat. But of course this is especially stated because with the it's a big problem for men. It has been recognized as a big risk factor for men. Well, and then smoking is something that has many problems attributed to it, and so it's something to be avoided. I'd like to conclude, to end there, and we'll